Sometimes things can go wrong after breast augmentation surgery, and if you've had the surgery and you're not happy with the results, Dr. Scott Ennis from Destin Plastic Surgery says they may be able to help.
There's a whole lot of things that can happen with breast implants. The almost 300,000 pairs of breast implants done only in the United States every year, and several million done worldwide. Obviously things come up. It's surgical. It's not an exact science. So you have to define the problems and what can arise, understand why women come in with concerns about their implants, and then we can address each of those concerns individually. Oftentimes you have women like this who have the old saline implants where the rippling shows, especially women that don't have a lot of breast tissue. Very, very frequently they'll see this and become very self-conscious of it because it shows in bathing suits, in their cleavage, even across the sides of the breast, in areas that would show in a small bathing suit. So one of the things that we frequently do now is the new silicone implants. These are the new cohesive gel implants, and you can see that they're much softer, they feel more like breast tissue, and ripple significantly less than the saline does. Works great in all patients, especially in thin women that don't have a lot of breast tissue. It covers the, stops the rippling so they don't have the issues that show in bathing suits and low-cut shirts. Pretty amazing new technology. Other issues that can come up, capsular contractures, implants in the wrong place, different things like that can arise. Issues like capsular contracture can occur here, like the patient on the left that you see where the implants have gotten tight. This can happen for different reasons. Oftentimes it's scar tissue that builds up around the implant. In this particular case, this lady had implants on top of the muscle. All the implants we do now are under the muscle because they're much prettier, they're softer, much better support to the implant, and the muscle will help support the implant and minimize the risk of them getting hard and tight or getting these capsular contractures. So oftentimes we'll see women that come in where one implant's gotten hard, such as this woman on the left. We've got to go in and remove the scar tissue, replace the implant so that she gets the symmetry back and feels comfortable in clothes. You can get the issues where they get hard, you can get issues with the rippling, but you can also get issues that are much more significant, much harder to fix, such as issues like this here on the left, where an implant can migrate towards the middle and they develop what people often call uniboob or synmastia. Synmastia is where the implants actually touch in the middle. These are much more complex things where we're using skin scaffold. You can even use donated human tissue to go in and rebuild the cleavage, rebuild the muscles. Fairly complex things that we have to do for some of these procedures to get them fixed. One of the unique things about our practice is we put all our breast implants into the underarm. It's a little tiny incision right in the crease in the underarm, so the women don't have a scar on their breast at all. And actually, a lot of the revision stuff can be done through the underarm as well. We can take implants out, we can put new implants back in. So there's a lot of things that we can do and fix a lot of things through the underarm without having a scar on their breast.
Well, you know, we live at the beach, so I'm in a swimsuit a lot, and with the saline implants, you could visibly see rippling on my chest, and so that was my main concern. That bothered me a lot. Also, I'm very active, so working out, I actually had a little bit of pain from the implant, so that was another reason why I came to see Dr. Ennis. I'm very happy with the results. I can go to the beach in a swimsuit. I don't feel self-conscious anymore. I don't notice any rippling. I even got pregnant after the surgery and was able to breastfeed, and I don't have any pain, so I'm loving it. The doctors have seen it all. They've seen it all, so when you come in, they really treat you like family and make you feel comfortable, and do something about it today so that you don't wait and continue to feel uncomfortable.
So if you have any questions about your implants, if you have concerns or questions at all, please feel free to contact us. There's lots of good information on our website, theplasticdoc.com. Always happy to see anybody and explain their options. There's no obligation to have surgery, certainly, but we see people from all over the world that come in just looking for options and ways to potentially fix the problem.